Good day, ma'am. Supposed to be, I will going to have a demonstration on how to start an intravenous therapy, how to prime in IV tubing, and how to spike in IV bag. But sad to say, I don't have the material, so I will just explain the procedure. But first, I will explain. I will just give the definition of what is intravenous therapy or IV therapy. So it is the giving of liquid substances directly into a vein. It can be intermittent or continuous. Continuous administration is called a intravenous drip. So the word intravenous simply means within a vein, but it's most commonly used to refer to an IV therapy. So what is the purpose of intravenous therapy? So the purpose of intravenous therapy is to supply fluid when clients are unable to take an adequate volume of fluids by mouth, to provide salts and other electrolytes needed to maintain electrolyte imbalance, and to provide glucose or dextrose, which is the main fuel of metabolism, to provide water, soluble vitamins, and medication, and lastly, to establish a lifeline for rapidly needed medication. So now, how to start and how to start intravenous therapy. So first, you will just review the physician's order. A physician's order is necessary to initiate IV therapy. Um, physician's order should include type of solution to be infused, route of administration, exact amount or dose of any medications to be added to a compatible solution, either hourly or 24-hour volume, rate of infusion, duration of infusion, or the time over which the infusion is to be completed, and physician's signature. So that would be the thing that include in physician's order. So next, observe hand hygiene procedures. So indication of hand washing and hand antisepsis. Wash hands with either non-antimicrobial soap and water or when hands are very visibly dirty or contaminated with blood or other body fluids. If hands are not visibly soiled, use an alcohol-based hand rub to avoid routinely contaminating hands. In all other clinical situations, decontaminate hands before having daily contact with patients. So do not wear artificial fingernails or extenders when having direct contact with patients at high risk. So importante jud kung when we do in IV therapy, we should wash our hands properly so that to increase the risk of to decrease rather the risk of contamination. So the third one is gather equipment. After you wash hands or doing a proper hand hygiene, so you will gather your materials. So prepare and gather the equipment needed for starting the IV. You will need a gloves, alcohol prep, tape, tourniquet, connector tubing, dressing, gauze, drip set, saline flash, IV catheter, and IV fluid. Every material that you need, you always check for the fluid's expiration date. So if di jud mo gamit kung expired na ba ato tanawon kung tanus pa siya pwede nga gamiton. And you inspect the administration set and choose the appropriate set. So that would be in gathering equipment. So next you would do is to do a patient assessment and psychological preparation. It is important to also prepare the patient for the procedure. After you gather your equipment, so you explain what you are going to do, introduce yourself, and verify the client's identity to provide privacy and to gain consent. So the next thing to do in IV therapy is selection of site and vein dilation. There are several factors that you need to consider before initiating vein fractures. The one is the type of solution to be infused, whether hypertonic solutions and medications are irritating to vein. Next is condition of vein. So use soft, straight, bouncy vein. If you run your finger down the vein and it feels like a cat's tail rather, avoid veins near previously infected areas. So next is duration of therapy. So choose a vein that can support IV therapy for 72 and to 96 hours. So magpili ka og that na makasupport within 3 days or 96 hours. So next is catheter size. So ang size sa imong catheter nga gamiton. Hemodilution is important. The gauge of the catheter should be as small as possible. So dapat kung kung mangita na ka imuhang kuanan sa IV, dapat mamili ko og mas gamay nga catheter size. It should be moigo ra pud sa imo sa iyang ugat. Di ka mogamit og dako nga catheter kung gamay ra yang ugat. So the next thing is patient's age. So if elderly and children need additional time for assessment and management of insertion. So kung imong pasyente is tiguang, so it takes time na makataod kag IV. Kay though visible kayo yung ugat, pero if kanang mutusok na ka, maglihok-lihok na lang ugat. So it takes time for assessment and management of insertion if your patient is elderly and children. So next thing to be considered is patient activity. Ambulatory patient using crutches or walker need catheter placement above the wrist. So kung next thing to be considered is unsay gibuhat sa pasyente or unsay iyahang current nga situation, either naka-crutches ba siya or ga-wheelchair. So dapat ang iyang catheter na na siya above the wrist, wala dire. So next thing to be considered is the presence of disease or previous surgery. So iyahang kaagi nga surgery. So patients with vascular disease or dehydration may have limited venous access. If a patient has a condition causing poor vascular return or mastectomy or stroke, the affected site must be avoided. So kung ang iya na siya kung stroke siya sa una, kintay na stroke niya na affected niya nga part is the right side. So i-avoid nimo ang side nga naa sa right. Okay? Kung na stroke naman siya, so it's either di na to siya ka-function og tarong. So next thing to be considered is the presence or shunt or graft. So do not use the arm or hand that has a patent graft or shunt for dialysis. So dili nimo gamiton tong na ay graft or shunt para sa dialysis. Next is patient receiving anti-coagulation therapy. Meaning patients receiving anti-coagulant therapy have a propensity to bleed. Local ecchymosis and major hemographic complications can be avoided if the nurse is aware or if the midwife is aware of the anticoagulant therapy. So if naay allergy ang pasyente, so mo-consider ta nga na siya allergy sa medication, sa pagkaon, animals, and environmental substances. So i-identify nimo ang allergens. So the things that I mentioned earlier is the factors that we need to consider before initiating benefactors rather. So to dilate the vein, we must use a tourniquet. Tourniquet is latex or non-latex used most frequently. Place na siya 6 to 8 inches above the benefactor site. So if BP is high, move further from benefactor site. If BP is low, move as close as possible without risking site contamination. So ang tourniquet, makatabang na siya nga makadilate sa vein para mas maklaro ni mga ugat. Kung ang BP sa patient is high, adto ka magtaod sa further from benefactor site. So if ani ka magtaod og tourniquet, dapat 6 to 8 inches man. Mas mabaw pa kung imuhang pasyente is kung ang BP sa pasyente is high. Kung low, dapat ka na siya as close as possible. So next thing to help dilate the vein is gravity. Position the extremity lower than the heart. So dapat iyahang kamot is nakaposisyon nga lower than the heart. So ayun nga na para mas mukuan iyahang gravity. So lain pud nga makatamang is fist clenching kung pagkumo. So you'll instruct the patient to open and close his or his fist. So yun para mas maklaro ang ugat. Pakumuuni mo ang mga patient. So next that can help to dilate vein is tapping vein. You will not just do hard tap. You will just tap softly using thumb and second finger. Flick the vein. This releases histamines beneath the skin and causes dilation. Do not slap the vein. Or either warm compress 10 minutes maximum. Do not use microwave. So if you warm compress, do not use microwave. Blood pressure cuff. So inflate to 30 mHg. Great for fragile veins. So mato yung mga butang nga inuhang buhatan para mas dali ka makita og ugat to dilate vein. So to start an IV therapy, you must stay calm and be prepared. Hitting the bullseye on one try will depend on the nurse's preparation or the midwife preparation and skill. You and your patient should be composed, as a nervous and rush procedure will likely result in failure. So, kung mag-insert na ka og IV therapy, you must stay calm and be prepared. Kay, if mangulba ka, so that will likely result in failure. You have to trust yourself nga makaya nimo. Di pud ka makita sa mga pasyente nga gikulbaan ka kay mawala na sila salig. So alay ang scientific explaining the procedure to the patient and determine the patient history with IV therapy. You also ensure the patient comfortable and sufficiently warm to prevent vasoconstriction. So ipa-feel nimo nga comfortable ang patient para di siya mag-vasoconstriction. So next thing you do to start an IV is exude confidence. So you must believe in yourself and reassure the patient. You know what you are doing. So i-reassure nimo ang patient kung unsa ang imong gibuhat para mas saligan pa niya. The patient will be encouraged by your confidence and you too, of course. So mas makasalig ang pasyente kung makita niya nga confident ka kaayo, though di pa ingon nga anad ka anong butanga, but confidence will help you. So next is assess your if there is needle phobia. So needle phobia is a response as a result of previous IV insertions. So ang needle phobia is kanang mga tao nga nagkahadlok sa dagom, like mangurog-kurog sila kung makita sila dagom, maratol dayon. So symptoms include tachycardia and hypertension before insertion. So ang tao nga needle phobia, mga cause sila tachycardia, high blood before insertion. So next is observe infection control measures, like wearing gloves when you insert a cannula to the patient. So like wipe a cotton swab or alcohol pad on the insertion site to minimize microorganisms in the area, and also to visualize the chosen vein more clearly. So mas importante kung magkuha na ka og kanang cannula sa patient, you must wear gloves so that you will not contaminate any microorganisms. Next is assess the vein. So before inserting a needle into a patient's vein, you will just you have to assess its condition first, para kung kuan if hydrated ba imong pasyente. So ayang kuana na siya firm, supple, and easy to reach veins. So next is feel rather than look. So if feel nimo nga nakahit na ka og vein, trust your fingers. Ayaw tanawa kundi feel rather than look. Saligan nimo ang fingers nimo nga manajud nga ugat. So ask your patient. So the patient may know more which veins are suitable based on his previous IV history. So kung tanong nimo imong patient kung asa ka rapid sa una, asa ka gitauran og IV para mas makadali ka og kanang makaibaw nga ana day ang bust na side. So next thing to start an IV therapy is use an accurate cannula size. So sa ginaingon na ako kanina, magamit ka og kanang appropriate cannula size, mga ma-fit sa imong gauge nga gigamit sa patient as well. So to start a catheter insertion, you will first select select needle. The smaller the gauge number, the bigger the catheter. So ang catheter na-vary na siya sa different gauges. So mas kung unsa ang appropriate size sa imong vein, dapat dili ka magamit og kanang dako. Kung gamay ang ugat, so dapat kanang gamitan po nimo siya gamay nga gauge. So after needle selection is you wear your gloves. So nganong kinahanglan ta mag-wear og gloves kung mag-IV therapy? Kay tungod to observe sterility. Kaya kanang IV, udong na siya sa bloodstream. So if di ta mag-gloves, di ta mag-observe og kanang proper measures, so naay tendency nga makontaminate nato ang dugo padung sa iyang throughout his or her body. So dapat we should wear a gloves to protect ourselves and the patients also. So once you've done your gloves, you'll be now preparing the site of insertion. So after ka nakakuan og gloves, imong i-prepare ang site for insertion. So ang imong pasyente is place exhibit in independent position. So like kantay nakahinga siya or nakalingkod. So ang iyang kamot is lower than client's heart. So nakaingana. So after ana, apply kag tourniquet ani sa babaw 15 to 2 cm above then puncture site apply na mag tourniquet nga itap nimo ang iyahang fist para mas maklaro ang kuan, mas maklaro ang ugat. Then after nimo na nakit-an kung asa ka mo kuan, hinluan nimo nga kuan para mas sterile siya kay tusukan man nimo dagom. Atong dagom sterile man to, so dapat you observe sterility. Hinluan nimo in a circular motion animo. Then next is, so after ka naginlo, i-dry sa tanimo siya usa ka mo insert og needle. So firstly ay is pangutan ni mga patient kung asa iyang dominant hand. Kay kinta iyang dominant hand is sa left, so di ka mo insert og catheter ana kay matandog na siya kanunay kung anak ka mo butang kay syempre mo man ikapunan niya gamiton, so ari jud ka sa right. So hold the over the needle catheter. So mag-insert na ka og needle, dapat way pagbaduha, trust your fingers nga mauna jud nga ugat, hit na jud ako. So imagine nga nakatusok na ka and nakahit na kag vein, so suddenly lack of resistance is felt as needle enters the vein. So maka-feel man na nimo kung sa ugat pa nimo nasud or wala ka kasud. So kay kung makasud nimo, smooth ra jud ang dagan sa needle. Kung wala, rough na siya, murag hagashas kay murag naa ka sa muscle na nakahit. So after ato imuhang ilak kay mag-release man ka sa needle, imuhang ipagawas ilak sa to nimo para di ka safe ka sa needle. So after ato nga nalak, after ka nakalock and nakakuha na ka, so i-release na nimo ang tourniquet. After nimo i-release ang tourniquet, so apply pressure. So put pressure on the vein proximal to the catheter to eliminate or reduce blood oozing out of the catheter. Stabilize the hub with thumb and index finger of the non-dominant hand. So imo nga apply ng pressure kaya ron pa-reduce og kanang oozing out of blood. So next is remove the protective cap from the distal end of tubing. So i-remove to nimo protective cap naman, protective cap from the distal end of tubing. Remove nimo, hold it ready to attach to the catheter, maintaining the sterility to an end. So dito nimo tugunitan tong ihang tumoy nga mo i-attach sa catheter kaya ro maintain ang sterility. So next is remove the needle. So after nimo nga na remove tong protective cap, ang needle na po nimo i-remove. So you must carefully remove the needle, engage the needle safety device, and attach to an end of infusion tubing during the catheter hub. So yung pag-remove sa needle, careful kay basin nimo makatusok ka, dapat disregard na nimo sa safety nga butanganan. So after ka nag-remove sa needle, you initiate the infusion. After ka nag-initiate og infusion, you must take the catheter para mas kuan siya kanang di na siya matandog-tandog. Take the catheter by the U method. So imoon is U nga method kung matake ka sa catheter. Next is, after nimo nga tape ang catheter, you dress and label the puncture site and tubing according to agency policy. So if i-dress nimo or i-label nimo ang katong imong gitawran, label should have done on which date rather on which administration set must be changed. So like imo i-label dito is kanus ani mo gibutang, kanus ka nagtaod og IV, kanus unsang orasa of type and length of catheter mo to imo i-label sa puncture site. So next is document the relevant data including assessment. So everything nga you've done into your patients, so you must document any data including assessments. So after ka nag-record na mo nakaukuan, the last thing na imuhang buhaton when you do an intravenous therapy is mag-record ka sa data, but the most last thing is you wash hands. So pinaunahan is wash hand ka, so after dapat mag-wash hands na pud ka. So to observe proper hygiene and to reduce contamination. So that would be the steps or procedures on how to start an intravenous therapy. So now let's proceed to steps on priming IV therapy and spiking an IV bag. So the first thing to do when you prime and spike an IV bag is, of course, perform hand hygiene. This step prevents the transmission of microorganisms, as I said earlier. So the next thing or the next steps is check order to verify solution rate and frequency. I-check nimo kung unsay order nga maka-verify solution unsay rate and frequency. This ensures IV solution is correct and helps prevent medication error. So by checking order to verify solution rate and frequency will help to ensure IV solution na correct siya and di makaprevent pud ka og medication error. So after checking order, you gather your supplies or equipment. So this will need IV solution, primary IV tubing, time label, alcohol swab. Is remove IV solution from outer packaging and gently squeeze. So after ka gather sa supply, remove nimo ang IV kanang package sa IV solution. Tear the perforated corner of the outer packaging. Check color, clarity, and expiration date. So sa ginaingon na ako ganina nga tanang equipment, i-check nimo ang iyang color, clarity, and most especially the expiration date. Kaya kintay expired na siya. Nya, imuhang gigamit imbes tabangon imong pasyente gisamutan pa nimo. And our task is to help not to dili na to samutan og samot. So next is remove primary. So move the roller clamp about the drip chamber and close the clamp. Next is i-move to nimong roller clamp about the drip chamber after ka imong gi-open siya. I-remove nimo. So next, after moving the roller clamp, you remove the protective cover on the IV solution and keep sterile. Remove the protective cover on the IV tubing spike. So ito imuha na siyang remove of sterility hapon. Di mo i-touch tong sterile side. Be careful not contaminate the spike. So remove naman ka sa protective cover sa IV tubing spike. So be careful nga dili nimo makontaminate tong sterile part sa spike. Kay mo to siya isuod sa kuan sa sterile area, so dapat sterile siya before nimo siya isuod. Without contaminating the solution port, carefully insert the IV tubing spike into the port, gently pushing and twisting. So kintahig mo contaminating the solution port, insert na mo IV tubing spike sa port, gently pushing and twisting. So next is hang bag on IV pool. So after ka insert sa IV tubing spike, imo siyang ihang nimo ang bag sa IV pool. The IV bag should be approximately 1 meter above the IV insertion site. So ang IV bag dapat ihang ko 1 meter babaw sa IV insertion site. So dapat ta siya. So after nimo nga gibutang ang IV bag sa pool, so fill the drip chamber 1/3 to 1/2 full by gently squeezing the chamber. Remove protective cover on the end of the tubing and keep sterile. So after nimo gihang ang bag, so you will fill the drip katong na blue nga murag kuan mo to imong patuyokon. So by filling the drip chamber, it can prevent air from entering the IV tubing. So next is with distal end of tubing area or basin or sink, slowly open roller clamp to prime the IV tubing. Invert back check valve and port as the fluid passes through the tubing. Tap gently to remove air and to fill with fluid. By inverting and tapping the access ports and back check valves, makatabang na siya ma-displace and remove some air when priming the IV tubing. So once IV tubing is primed, check the entire length of tubing to ensure no air bubbles are present. So dapat kung naka-prime na gani ang IV tubing, i-check nimo kung yamo bay ka bubbles, yamo bay air nakasod. Kay kung kuan, this confirms that air is out of the IV tubing. Para makakuha na siya nga kuan, maka-assure siya nga yamoy air nga nakasod sa tubing. So then close the roller clamp cover end with sterile dead ender or sterile protective cover. Hang tubing on IV pool to prevent from touching the ground. So kung gihang nimo ang bag, so dapat ihang pod nimo tong tubig kay aron di siya makatouch sa ground. By this, keep the distal end sterile prior to connecting IV to the patient para mas kay makonect man nimo ang IV sa patient, so dapat sterile gyapon siya nga kuan kay aron mas makahelp siya nga mas dali ka maayo ang patient kung sterile, kung yung may mga microorganisms nga na-contaminate. So after close sa kuan, after kagahang sa IV tubing, so label tubing and IV bag with date, time and initials. So after nimo nakahang ka, ihang nimo ang IV tubing sa phone. So dapat gibutangan nato nimo label like kanus unsa nga date ang mo ga-prime ka and unsa nga time. Gibutangan nimo initials kung kita ikaw tong gataod. So by labeling IV solution bag as per agency policy, do not write directly on the IV bag. So dili jud nimo o kung pagkuha nimo sa kuan iyahang IV bag, dili nimo siya ana nga time butangan og label. So dapat kung kanus nimo siya gitaod, ana nimo siya butangan IV solution label. So after ka gabutang og label, so perform hand hygiene. Always do before and after hand hygiene. This will reduce the transmission of microorganisms and to protect yourselves and your patients as well. So that would be all, and thank you for listening.